Hi, I'm Susan Taylor with Scripps Health in San Diego, California. Your child is having a hard time focusing, paying attention, controlling impulsive behavior. They're grabbing things from people, interrupting others. They're squirming or fidgeting. Could your child have ADHD, attention deficit hyperactivity disorder? Joining us to talk about signs, symptoms, and treatment is Dr. Nicholas Levy. He is a pediatrician with the Scripps Coastal Medical Center in Encinitas, California. Doctor, thanks so much for being with us.
Thank you for having me.
Let's start with the basics. What is ADHD? What are the signs and symptoms?
ADHD is a biological disorder, really a normal part of human behavior, where about 3 to 5% of children have trouble staying focused on things that bore them. They tend to be very impulsive and they tend to be very active.
And when is the onset of this?
Well, we really can only begin to know that a child really behaves that way after they're about 6 years old. Although they always have it from the moment they're born till the time they die, it's a lifelong disorder.
But aren't kids by nature, kind of fidgety? I mean, they're constantly running and jumping around and their attention's kind of scattered. How do you know when these behaviors are something more than just being a young kid?
Well, you're quite right. Of course, kids do jump and run and tumble, but you have to look at the child's age and what you expect from them. If you have a 8-year-old who just can't sit still at dinner, leaves things lying around all the time, is always losing his possessions, there might be something going on. When a 5-year-old does that, we assume that that's part of the behavior at that age.
Can these symptoms change over time?
They do, because as children mature, they become more able to control themselves, and so they're more able to hide some of their behaviors. They say that ADHD, meaning the hyperactive type, becomes more inattentive as they become adults. So adults tend not to be quite as hyperactive as kids, and that's, yes, the symptoms change because of that.
And what are the causes and the risk factors for ADHD?
So ADHD is really a genetic disorder, and invariably children who have this will have a parent who has the same thing. But certain things can increase the risk of it. For example, moms smoking tobacco during pregnancy or taking drugs during pregnancy. Babies who are born too early are at some risk, and a child who has a traumatic brain injury might also be at risk for it.
And what are the treatment options for ADHD?
So treatment involves not only medication, which can be very useful, but also behavioral therapy, because once children are able to learn how to organize themselves, have tricks and tools for managing their impulsivity, they'll just do better. However, medication is a huge part of treatment.
Can a change in diet help reduce the symptoms of ADHD?
There's no really good data on this, but some children seem to become more hyperactive when they're given lots of processed foods, lots of refined sugars. And so I do think that a diet that's so-called clean, meaning organic, well produced, and includes lots of fruit and vegetables and grains and meats, and avoids processed food, is useful for children.
What if it's left untreated? What can happen?
Well, children who don't get treated tend to not do as well academically and tend to struggle a little more socially. But the long-term studies show that they still are able to live alone, support themselves. They do have a little more trouble with long-term relationships, and they tend to hold jobs that are not quite where they should be for their level of intelligence. And this is usually for academic reasons.
Can you outgrow ADHD?
I don't believe so, but you can certainly outgrow some of the symptoms. About a third of adults who have had ADHD as children will not need medication as adults. They manage themselves well enough not to need medication. And about a third of adults who've had medication will stay on it very successfully. But there are probably a lot of adults who have ADHD that would benefit from medication as adults.
What are the common misconceptions about ADHD?
Probably the most common misconception is that it's bad behavior on the child's part, and that if you punish them properly, they won't have the ADHD symptoms. Now, I guess if you punish a child enough, they won't have behaviors that you may not like, but it's going to impact them far worse. And I'm sure lots of other very severe psychological problems are going to evolve.
And talk about the emotional stigma of having ADHD.
It seems to be getting less, but anytime you have a label for anything, people tend to say, well, I've got something wrong with me, and therefore I'm less, or there's something bad. I spend a lot of time talking to children about how the ADHD brain is actually a better brain. Kids with ADHD tend to be very creative. They tend to have a wonderful sense of humor, and they're often very intelligent. And so once they get their academics under control, once they learn how to be a little more socially, I'll say, acceptable, they actually are very successful. And I think as adults in jobs that fit them, bring more to the table than those that don't have ADHD.
So if you've got that emotional stigma, let's say you're being teased or bullied, or if somebody thinks, the ADHD, you have a mental illness, how do you as a parent, and how does the child who has ADHD, how do you deal with this?
Well, children are always teased for lots of things. And I think it's important to empower the child to be able to respond to the tease. And I tell them to tease the tease or to make fun of it. So someone says, oh, you're goofy, or you have ADHD, that, you've got a bad brain. And they say, wow, thanks for noticing. And it kind of makes them feel, they laugh it off. But it can be difficult, and sometimes adults need to intervene. But the more that the child knows about themselves, about their own responses, and understands how wonderful they are with their ADHD, the better off they'll be.
If you suspect your child has ADHD, what's the process for diagnosing it?
There's no perfect way to diagnose ADHD, and a lot of the diagnosis rests on reports that are filled out by parents and teachers to see how the child's behaving in those two environments. I do believe that it's worth doing more than that. I really think that a neuropsychologist should assess the child for things like learning disabilities, anxiety or depression. And you have to look also at the family history. Is there anything going on within the family that might make the child inattentive? And I also like to do some blood work just to exclude other disorders and illnesses.
And as they grow up, is it important to talk to their teachers about this? Do they need special education?
They don't necessarily need special education, but I think they do need some help in the school, and particularly with things like organization and planning. They may need accommodations for extra time on their tests, or testing in a smaller environment that's less distracting. So it's useful to have the school involved.
Any final thoughts, Doctor?
ADHD affects at least 3% of the population. And in school, it is really helpful to have teachers involved in the care, because the child needs academic support more than anything else. Social support and love in the family, of course, go a long, long way too.
Doctor, thanks so much for being with us. We appreciate you taking the time.
Thank you so much.
If you want more information on ADHD, just click on the link or go to scripps.org/videos. Want more critical information about your health? Please subscribe to our Scripps Health YouTube channel and follow us on social media at Scripps Health. At Scripps, we're here for good. I'm Susan Taylor. Thanks for joining us.